Morning, folks. We'll give people a few more minutes to jump on. Okay, we're up to 96, 97. That's not bad. And we are recording this meeting, so if folks can't join the whole time, then you'll be able to go back and rewatch. All right, so we seem to have stabilized our participation, so let's get started. Good morning to all of you, and thanks for joining us. I hope everyone's doing well as we kind of creep slowly into winter. We received some unexpected news last week and wanted to share that information with staff and let you know our response and plans and answer any questions that we can. Our goal for this meeting is to be really transparent with staff about what we know and create some space to answer questions and engage your thoughts. And if 30 minutes isn't enough for our immediate questions and sharing, then we can stay a little bit longer if folks want to. So the situation is that last week, the Board of County Commissioners announced their proposed budget for 2024, and included in that was a cut to Public Health's county-based budget by approximately $1.7 million, which is about an 18% decrease in our county-based budget and about a 7.5% decrease in our overall budget. The proposal was made as a global budget recommendation. For operating and staff, it wasn't line itemed for particular people, as well as a decline of a request for an additional HHS 1A funding that HHS had previously approved, but it didn't receive commissioner approval. The BOCC did approve our existing requests in the sustainability tax budget. So we were expecting cuts in the coming years. We had gotten some signals. The commissioners had said, you know, the budget outlook for the next 3 years is going to be tightening up because of declining county revenues. And we in public health had begun to work on plans for how to achieve some budget reductions strategically and gracefully while also increasing revenues and minimizing impact to staff. But this decision came a lot sooner than expected and unfortunately without any warning to us. And we're going to need to accelerate plans for how we do those pieces of work, increasing revenues, creating efficiencies, and ensuring our agency is on solid ground to address community priorities. And we recognize that these kinds of rapid changes can be really stressful for all of us. And we will do our best to slow down the impact to the agency and be really thoughtful and transparent with you as we go through this process. And I really want to emphasize that this is, at this point, it's a budget proposal. The final budget from the county commissioners won't be made won't be settled until December 5th, which leaves us a little bit of time for planning and making adjustments to our final budget for the Board of Health, which is due at about the same time. So I'll share for a second any questions so far, but what I'd like to do is share next kind of what we're doing in response to this and kind of what some of our goals and commitments are with you going forward. But any clarification questions about just what the situation is so far? And let me pull up the chat so I can see that too. Good morning, Soda. Not a good situation. Yeah. Okay, so what we are doing, so we have been in touch with our board president about this and let her know, and we will share some high level points, kind of similar to this meeting tonight at our Board of Health meeting, but we wanted to talk with staff before we share it with the Board of Health and the public. Because this is a proposal and not a decision, we're working on a plan to quickly approach the county commissioners and ask them to reconsider. We feel that we have some very strong arguments for a request to either delay or at least decrease the proposed cuts. We're currently working with the Office of Financial Management to determine what flexibilities we have to optimize our response and to create a revised 2024 budget quickly. For instance, we're trying to confirm whether our budget that goes to the Board of Health in December has to be balanced and we're getting some conflicting signals about that. In conversation with Jeff Zayak and some other leaders in the county, they have said we don't have to have a balanced budget, but we're trying to clarify that with OFM. If we don't, it would be helpful because it would give us extra time to plan, obviously. We are also starting to immediately identify areas to tighten up that are some low-hanging fruit and accelerate our plans for revenue generation and grants, and identifying areas of work we maybe need to not have to do, including in relation to county departments and other community partners' efforts. We will be reviewing and reallocating reserves, and we'd also like to ask programs to tighten up program costs when possible. And we can talk more about how we will. Thank you, OFM. Yes, Office of Financial Management. Thank you, Heather. We will also be asking programs to look at areas where they might be able to tighten up their budgets, and we'll talk about the process for that as we get a little deeper into this. We may need to re-examine things like hiring plans and timelines. We may need to utilize more internal hiring to redeploy people. We'd like to explore efficiency opportunities, and we're already working on that. We're also engaging some budget analysis and projections to fully recognize the impact of this proposal, including unintended consequences and areas where the commissioners may not recognize their impact yet, or that may affect future budgets and needs for us, so that we are taking a longer term view on what this cut would mean for us as an agency. And as we gain clarity in these spaces, we'll be sharing our ongoing efforts and updates with you all. Okay. And we have a long list of things to look at. So lots of ideas, but the more the merrier at this point. So our goals is we want to be really clear that our first goal is to convince the county commissioners to rescind or decrease the reductions. I don't know if that's feasible or not at this point. If we're not successful, we'll work to slow the impact, to give us time to plan together and implement this gracefully and intelligently, and with consensus and awareness. We would like to protect staff positions by using attrition, but without increasing workloads to teams. So attrition is a great strategy, but then if the same amount of work just follows on to a smaller team, then it's not taking us where we have committed our values in the agency, which is to really try to create more reasonable workloads and work-life balance for staff. So that's something that we want to pay attention to. So it's doubly important for us to be proactively identifying non-essential activities and expenses that add less value to our work. At the same time, we need to ensure we don't create those unintended consequences, such as reducing less important activities in some areas that could affect important work in other areas or jeopardize future funding opportunities. Another goal is that we want to maintain pay equity for Boulder County public health staff. We worked really hard on that the last couple of years to create a lot of historical inequities with the county. And we do not plan to reduce merit or COLA plans for 24. We think it's really important for public health to stay in alignment with other county departments, both as a matter of respect for staff and for equity. Not all of the decisions we will need to make are going to be easy, but our commitment to you is to be thoughtful, strategic, collaborative, and transparent, most of all, as we go forward. To keep staff connected to the process, we will have regular updates where staff can ask questions and share feedback and thoughts about how it's going, or proposals that are on the table. So we would like to take some time to answer your questions if we can, given what we know at this point. Catherine, I believe, is on the call. Are you there, Catherine? In case we have more technical questions, and I'm just going to take a quick look at the chat.
Yep, I'm here, Lexi.
Is it possible that the commissioners could make more cuts to the public health budget in 2025? I suppose so. They have not committed to not making more cuts. Other questions?
Lexi, I know you might have addressed this, or not. There's another question from David in the chat around merit and COLA.
Yeah, I spoke to that briefly.
Yeah.
Our intention is not to not to be out of alignment with the county in terms of merit and COLA, but to apply the same pay equity and pay salary increases that the county is applying to other county departments, because our staff are county staff. The commissioners mentioned duplication in the announcements. What were they talking about? So I think one of the challenges that we've had with these 3 new commissioners kind of all coming in and not having a lot of historical knowledge is that they don't have a great understanding of public health. And I and other leadership in public health have spent a lot of time over the past year trying to educate them about what public health does, what our relationship to the rest of the county is. And it's been a little bit of a struggle, I will admit. We've had several retreats where we've talked with them about our programs. We've provided reams of information, try not to do it all at once so that it's digestible. And there just still seems to be a lot of confusion. Unfortunately, what we haven't had at the ready is documents that kind of clearly and concisely explain how our programs relate to other county and community programs. So for instance, really making it clear how our food nutrition programs supplement rather than duplicate other county food programs. Clarifying, although we did work on this, clarifying what our climate action work is in relation to Oscar's work. They're very different areas, but they complement each other, and Oscar can't do all of their work without us. So it's really important for us to focus on how we communicate our value and our role and the dependency of other county departments and community partners on our work for them to do their work too. So that's something we'll be working on.
Lexi, you missed a question. It's were other departments also cut, asked by Kyla.
So a lot of requests were declined, but I don't believe any other departments were cut the way we were. Parks and Open Space was told to draw $11 million from their ballot tax fund to pay for their costs this year, but presumably reverting back to county next year, so it doesn't affect their staff the way and their programs the way this will. So Rachel Arndt, how is our general? Oh, I'm sorry, Catherine, go ahead.
Sorry, I'm on mute. I'm going to combine some of the questions with the one that you just answered, Lexi, because they all
Great.
kind of play into what you just added. So there is one just a little bit further down that asks whether or not any other county departments had their general fund allocations cut. In response to what Lexi just shared, no. Public health was the only one that had their general allocation cut. And then that ties into Rachel Arndt's question, which is how has our general fund allocation changed over the last 5 years? Our operating amount has not changed. So that has always been 695,000. Our actual other amount that we have received is related to county funded salary, and that has only shifted with the increases in merit and COLA that we have received from the county. And then there are those other ones, which is the HHS and the S tax, which Lexi mentioned.
Okay. Elise asks, what will the process be for individual programs to review their 2024 budget and communicating potential changes with ANF? What would be the timeline for submitting those changes? Those are great questions, Elise. Do you have any responses for that one, Catherine?
Yeah, I just want to ask for clarity in that space, Elise, so I'm interpreting your message correctly. The way I'm reading that is you're asking about if you have any suggestions on your own specific budget that you want to submit as potential proposals for what we could do with the budgets. How would you submit that communication? Can you let me know if I'm interpreting that correctly, if you're thinking something different?
No, that's correct, Catherine. Lexi just mentioned at one point that individual programs might be asked to relook at their 2024 budget to see if there was areas for tightening up. So yeah, that's what I was referring to.
Perfect. I appreciate you asking the question. We had not thought through a process right now, but if you have ideas, if you want to send them to me via email, I will go ahead and start collecting those. And we will add them to the list that Lexi had already acknowledged and see where they fit in. We really appreciate the suggestions. When we make hard decisions like this, it's really wonderful to have the feedback of the specific programs. So you're addressing how it may impact you and where you would be less impacted through your voice.
Okay, how does this, Dave LaRocca asks, how does this affect the hiring of currently posted positions? So hiring was a topic that we had talked about briefly. We would definitely like to require that all proposed hiring come to management team to see if it still is a priority. For posted positions, I'm not sure. What do you think about posted positions, Catherine? Or do we want to take this back to management team for a special consideration?
Yeah, so I think that was under discussion that we were going to talk about was bringing all positions that are considered vacant. So that would even be positions that are posted currently, to talk about all of them so they are all given fair consideration, and then prioritizing. That shouldn't make anybody super concerned right now. We do understand why there are positions out there and why we need to fill them, but we do want to give everyone equal consideration as we're having these conversations.
Okay, will there be a reduction in permanent full-time staff at BCPH? I imagine this will affect hourly and term staff. We don't quite know yet, Lalo. It's a great question, and I know that this is the $1 million, well, $1.7 million question, right? But we don't know yet because we are looking, we want to start with the low-hanging fruit. We want to start with the question of, what reserves can we put to this? How can we buy time? Can we buy enough time with the reserves that attrition is an effective strategy? So I think it's a great question, and I don't think we have the answer to that yet. Knowing that we were the only ones cut, this is from Janice Stigler. What are the commissioner's priorities with our funding? Is this towards any other department? There's not kind of that it's not a zero-sum game. I mean, there are some other departments that had urgent needs that couldn't be ignored. But I don't think you can really attribute cutting $1.7 million from public health's budget in the totality of the county budget, which is, I don't know, how much is the county budget? $100 million, $150 million. I don't think that 1.7 was necessary to fund other things. I hope that answers your question, Janice, but if not, let us know. Elise and Sid, team will be doing that together and asking, okay, that was Kelly responding to Elise. Jax, can we assume that only programs receiving general funds will be affected? No, I don't think we can. I think we have to be reasonable, to be strategic. I think we have to look at the totality of our programs. The direction that we've gotten so far from OFM is that the commissioners were not expecting us to limit our cuts to the list of folks that are county funded. It was just a global submission, a global allocation that we need to decide about. Do you want to add anything there, Catherine? Okay.
No, I think you've really covered it. Yeah, go ahead.
Yeah. Amanda, will we be halting non-important spending right now, even if it was in the 2023 budget? I think that's important for us to consider anything that's not important that we can defer at this point. So yeah, I would hope that, I mean, even with just, effectively a month left in the year, if there are things in the 23 budget that are not critical, and that the funds would roll over, then that would be helpful. Catherine?
Yeah, so you finished that up perfectly, Lexi. The only caveat that I would provide in that space is if you have grant specific. I'm on mute. Clearly that doesn't help anybody. So what I was saying was Lexi wrapped that up perfectly, which is that if you do have grant funds right now that can cover certain expenses and you're not expecting to fully spend down your grant, think about how you can utilize those funds. Even if they are, as Amanda said, they are non-important, the grant funding, that won't roll over. We want to make sure you do utilize that funding that comes in.
Mel asks, I'm assuming that there are some politics involved here. Do we have any ideas why this is happening? Not particularly. Nothing was communicated to us about why. Just kind of the comments, the very general comments about we want you to reduce duplication of work, even though we're not clear where there's duplication. Yeah. Stephanie asks, has public health leveraged any support from statewide partners to relay the importance of our work and the impact on the community? So we just learned of this. It's a proposal right now. But Stephanie, I'm happy for you to speak a little bit to what you have in mind there.
Can you hear me?
Yes.
All right, I'm having some technical issues here, so things have been cutting in and out. I'm wondering how we can use the relationships that different divisions have to kind of have them advocate for our work and why it's important. Like, how can we get involved in trying to get that across to the commissioners? Because it sounds like you've been trying and it's just not getting through. So
you are right on that count, Stephanie. So let's put that on the list of things to explore a little bit more and what that might look like, if that sounds good. Thank you for that suggestion. Rob, would our allies that we collaborate with, that we supplement versus duplicate work, also add to the conversation to help the understanding of what we do? Absolutely. So, I mean, I think this is part of our argument about why we want them to at least delay the cut, is to give us time to do the work that they asked us to do, because it doesn't make any sense to ask us to do a review of our work that duplicates work, but to make cuts before we finished that analysis, right? We have to have the information to make the cuts. And so what we don't want to do is rush into a situation where we're making cuts before we know where the right cuts are. That doesn't, it's just, it's really, I think it's unfortunate thinking. So I think your point, Rob, is excellent. And I will tell you that also last week, as this was being announced, we were asked by the commissioners to work with HHS and community services to kind of map out where there might be duplication. And so it's like, what I would like them to do is to recognize that we're happy to do that and we will commit to it. And you need to give us time to figure out what the right answers are. So Catherine reports that the 2023 county budget was $593 million. So it is a little bit hard to see how $1.7 million would make a big difference for the county, and it's easy to see how $1.7 million will make a big impact on public health. How will the cuts affect the BCPH indirect rate for fiscal year 24? Won't affect them. Won't affect the rates and won't affect the pull-in because we don't charge the county indirects. Anything to add there, Catherine?
You got it.
All right. Colleen, is it related to what we're talking about? Or a new question?
Somewhat. It was kind of related to what Rob and somebody else asked, but I'm just curious if there's room for staff input here. Like, I mean, we can obviously channel it through you. I'm just thinking, I've only been here for a year, not to get all woo-woo, but over the past 6.5, almost 7 years with the county, I have seen the impact of public health on the entire community, and specifically the mountain community, that they spent valuable time serving the 1% population. And I just feel like, is there any room for more of that qualitative data and those stories and everything that this just hurts my
I
heart.
think we absolutely should be sharing that. One of the things that we're not consistently great at in public health is really telling our story. And I think that sometimes that makes some of the biggest differences. I don't think it's strategic for us to try to create a lot of pressure on the commissioners through our partners right now. I think the more important approach is to share with them what the likely impact is going to be, and let them know that, you know, the community will understand this as the county doing this. It's not, they won't, you know, separate public health from the rest of the county. But I think starting to collect those stories, I mean, gosh, we should be doing that anyway, right? We need to learn, we need to figure out how to tell our stories better. So that's a great idea. Thank you. Do we know, sorry, this is a question from Carrie. Do we know what the specific amount that is being cut from our budget is based on, i.e. what were the reasons for that specific sum? No, I think it was arbitrary. Does the county budgeting process typically involve EODH conversation and collaboration, or this surprise budget cut anomalous? So I think that the amount was random. We have not, certainly we haven't heard any explanation for why they picked that amount. But maybe they had reasons, and that's part of what we want to ask them is, you know, what were you thinking? What led you to this amount? And does the county budgeting process typically involve EODH conversation and collaboration? No, it doesn't. It involves conversations between the commissioners and the department heads. But you know, I think these new commissioners are having a hard time figuring out exactly how to communicate with public health, because we have our own board of health, and they're, you know, they can't go into a meeting with us and make a bunch of decisions like they can with other departments. And I think it's creating some confusion with them about how to best communicate with us, which is something that we've been working on and will continue to work on, but it's a little bit tricky. Catherine?
Yeah, just to tag on to what Lexi said in that space, not only do we have new commissioners in this arena, but we also have new FOM staff, our Office of Financial Management, that will help leading the budget. So we saw new approaches come up this year that we were not used to, and that's why Lexi's been having a lot of follow-up conversations with other teams to try to figure out, okay, this was a little wonky, how can we get back on balance going into this next year?
I just want to say before you all go on, it's time. It's 11 o'clock, so I hope you're all okay with continuing. We just want to acknowledge that it is 11 o'clock.
Thank you, Dahlia. And we'll stay on and continue to answer the questions in the chat and other questions that come up. Thank you all for joining us. For those who have to leave, and feel free to reach out if you have ideas or thoughts or specific questions. Danny asks, just to reiterate a question I didn't understand the answer to, where is the money that's supposed to get cut from public health going to? It's not going anywhere in particular, Danny. It's part of the county's anticipation of tighter budgets in the future and their effort to just start to cut costs. There's not a direct correlation to anything. Which ones are the departments with urgent needs? So the commissioner's proposal meeting is actually recorded, and maybe somebody can stick the link to that in the chat if staff want to watch it. I think that'll tell you some of the spaces where there were particular new contributions. One that stands out in my mind, but I want to emphasize this isn't the only one, is that the Boulder County Housing Authority had a $5 million deficit. And I know that the commissioners had to step in with a one-time replacement to keep the housing authority solvent. Would our allies, Jack says, yeah, happy to support the collaboration with allies. So I would just ask us to be a little bit cautious in that space, because I have heard from other departments that when they have had community partners go and advocate on their behalf, that it actually created the opposite response than was expected, and it created some additional resistance. So we just want to be careful about we want to be respectful, and I think the first step is to really try to understand better what their expectations are and make sure that they understand the impact and the kind of benefits and costs of this recommendation. I'm sorry, I want to, so Heather, can you, if I'm missing something with Danny's question, can you help me understand?
Oh, I was just saying there wasn't like a specific answer of we're taking the 1.7 million and putting it here, like
That's
somewhere
right.
else. That's all I was saying.
Yeah, thank you. I will say the commissioners did something else that was kind of unprecedented, which was they did not give the sheriff all of the money that they asked for, but those were new requests. Okay, Carol McInnes, how can we help identify areas where we can help reduce program costs? For example, if we have ideas about ways programs might share resources, change processes, or reduce time-consuming work. Great question. I think that's part of what we're going to be working on over the next couple of weeks, is how do we set up effective processes for staff to share ideas or take ideas forward. It's a little bit tricky because it's an amount of money that's kind of, it's like it's in between, oh, well, we can just fix this and we have to do a total restructure. It's neither one of those. It's kind of, it's an amount of money that we're going to have to work on, but we also need to be careful about what we're changing to make sure that we're maintaining the integrity of our work and the impact for the community. Shauna Johnson, one idea, have the commissioners shadow the work we do. I think we should start doing that. That's an interesting idea. HHS, yes, thank you, Jordan. I'm sorry, I work in acronyms. HHS is Housing and Human Services, CS is Community Services. Curious how our county allocation compares to other counties in Colorado, especially the Front Range. Thank you, Erin. That is actually some information we are gathering right now, and we'll take a look at. Staff input equals vote. Sean, do you want to expand?
Oh, that's just it. Somebody asked, how can our staff get involved? And that's a pretty vital way to get our voices heard, is to vote for commissioners who support public health initiatives.
Everywhere. Thank you. Okay, so it looks like Rachel Arndt pushed the recording to the meeting from last week on their proposal into the chat. If folks want to take a look at that, and public health starts at minute 17:30. Thank you very much for doing that. Laura says housing is crucial. I'm curious if the sheriff's department also had a cut or an increase. I think we just talked about that. They didn't get a cut, but they did not get all of the, in fact, they didn't get in many requests that they asked for at all, which is very unusual. Are there ways to strongly influence legislation during statute changes? For example, food licensing has always been underfunded and fees are set in state statute. Great question, and I suspect your team knows more about that than I do, Shauna. So yeah, I mean, I think there are areas of expertise in our staff that we're going to really draw on, and this is a moment for folks to step into leadership and to help find solutions that'll benefit all of us. Even though we don't have control over restaurant fees, I think it's a really good question about whether there might be a more concerted effort to influence them. Kyla asks, historically, BCOCC has supported BCPH more than other commissioners have supported their county health departments. Don't know about currently. Right. So that's why we're going to take a look at the data now, Kyla. I will tell you that in our most recent analysis and talking with Jeff Zayak, he said that he thinks we're now underfunded compared to other counties. So that's why we want to take a look at it. Thank you, Jordan. BOCC, Board of County Commissioners. Okay. Other questions?
Lexi, this is not a question. I just wanted to share with the group that I've been capturing all the questions and answers, and maybe we should probably put these out or make them available so people can review them if they still have similar questions or if people weren't on the call.
That's terrific. Thank you,
Yeah.
Indira. Okay, so Rob asked, so what was the process to pass along knowledge from the commissioners that leave and the new ones that come in? So when Marta and Claire joined, it was only Matt Jones as an incumbent commissioner. And I don't know what their process was. I think the new commissioners have a very strong vision of what they're trying to do. And it isn't always communicated clearly and ahead of time and created through consensus sometimes. So I think it leaves gaps in their understanding of what their vision might end up looking like. And it's a little bit of a challenge. And so we do need to continue to help them understand what public health does, how we affect our partners' work, and what they're likely to see with these cuts that they can take ownership of. Lisbeth, the extreme relevance of investing in public health should be more than clear after what just happened with COVID-19. I could not agree with you more, Lisbeth. Yeah, we will continue to advocate and continue to stay transparent, and make sure that times get put on the books for regular check-ins with you all. Carrie, what you got?
Lexi, do we know what the vision of the commissioners is?
So they recently put out their county priorities, And they were in three categories. One was kind of family stability and sustainability, which had to do with things like living wages, and kind of protecting families. The second one had to do with climate. And mostly they seem to have a predilection for wanting to put funding for climate into carbon capture, without realizing that there are so many other needs in the climate space that have more direct local impact and relevance than what we can accomplish as a county in climate in carbon capture work. And the third area was governance. And so, you know, I think that I get the feeling that they feel like, you know, times are different than they used to be, and the county can't continue to operate with just expanding and expanding, and we need to make some hard decisions about what our priorities are and how we can have the best impact on the health and well-being of the community in lots of spaces. And I'm all for that. I think that's important, critical, in fact. My challenge right now is that, you know, even though it feels like I've been here for a long time, really, I'm kind of a new leader. Thank you, Indira, for taking over half my work recently. You know, we're kind of we've got a lot of new leadership and we're getting our feet under us and we just need a little time. And we'll get there, but we want to do it gracefully and we want to do it in a way that supports our staff and our community. And frankly, that also supports the reputation and image of the commissioners themselves, because I'm not sure that this is going to land the way they think it is.
No, thank you. I appreciate that. And thanks, Jordan, for putting information in the chat and just trying to understand the principles guiding this. So thank you.
Anything else before we close it out? Yeah, Kelly.
Yeah, I just wanted to say I wasn't really going to be talking in this scenario, but you know, I can never shut my mouth in these spaces. And you know, I just want to thank staff here for understanding and hanging with us. I mean, without you all, you know, it was super stressful to first hear this news and things like that. And I think Catherine and Lexi in particular have really jumped into the space, and Dira and I have been doing our best to back up and things like that as well. And I just want to say thanks to the staff because we really appreciate y'all. And this is a hard, you know, thing for us to look at, but we are more confident with having you all in this space with us. So that's all I really wanted to say.
Yeah, and we'll do this. We'll do it together. As I said, there may be some hard decisions, but we are committed to, you know, doing a little overtime, extra work, because we don't have a pandemic anymore. So what will we do with our time? To trying to get this right and making sure that decisions are really considered. Mary, were these decisions made in executive session or must the minutes of this deliberation be public? So it's a proposal and it was public, and Rachel Arndt shared the link to the meeting where you can watch the whole thing. And it's remarkable. There are probably 40 slides with like 10 light items per slide, and the commissioners just kind of went, we approve 1 and 3 and 5 and everything else is declined. So it was really a rapid fire. And I think that it's a real departure from the way that previous commissioners have thought about budgets, in terms of being much more down in the weeds about what they were going to do. Oh, sorry, Mary, that was just the announcement. So, I mean, yes, the commissioners had lots of conversations about what the county budget was going to be.
The minutes
I-
typically posted, I mean, it takes time to draft minutes. So on the website eScribe that Rachel had put, there's for the minutes that have been completed, there are like HTML and PDF versions. So Mary, you may have to wait and kind of just check until the minutes are posted.
But I think what Mary's asking is, were there previous conversations where there was
Oh, okay.
deliberation? And I don't think so. If there were, I mean, we, public health had conversations with them about the budget. We've been having conversations with them for a year about the budget. But I don't think that those conversations were public. Yeah. David Baum notes that in his 35 years at BCPH, I've never been aware of this type of budget cut. I hear you. Mary, did we get to your question sufficiently?
I think you answered the question to the best of your knowledge, but the Colorado Sunshine Law says that any meeting of more than 2 members of a local government body must be public, and that includes conversations and emails.
Thank you. Catherine?
I don't have a response specifically to what you're identifying, Mary. I just wanted to acknowledge next steps as we see the conversation slowing down a little bit. So as Lexi shared with you, we currently have a running list of ideas, low-hanging fruit that we'll be working from. The question that Elise provided, if you have some ideas already in mind and your team is working on them, please do check with your section or division manager just to see if you're going to send those all as one team or if it's okay just to send them over. In addition to that, to acknowledge Carol's question, we will also be providing some instructions and thoughts when we are addressing the low-hanging fruit, because we do really want staff voice in the process as we are talking about some of these components. So we will be communicating both ways, hearing your thoughts and also sharing out ideas about where we want you to take a look or thoughts or considerations that we're currently having. Also, the Board of Health meeting is tonight. We will discuss this at the Board of Health meeting. So there will be more areas where communication is happening in this space as we learn more as we go.
Okay, just to reiterate with what Kelly said, all of us really appreciate this amazing team, and we know that we will rise to the occasion and get through it together. Thanks for your understanding and your support. We will continue to advocate and do everything we can to make this as painless an experience as we can. Anything else before we sign off?
I know this
All
is
right.
probably going to be a lot of work for admin, so I just wanted to thank Catherine for her leadership there too.
Yep. Thanks for that acknowledgement. And thank you for your thank you.
Yes, thank you, Rachel.
All right, everybody, take care. We'll see some of you at Board of Health tonight, and have a good day. Get some sunshine.
Thank you.